Hi, I'm Chris, and today I'll be collecting a sputum collection from this mannequin here. So the first thing I'm going to do is introduce myself and provide privacy. So good morning, my name is Chris Brunelle, I'm a student nurse, and I'd explain the procedure. Today I'll be collecting a sputum sample from you. So I provided privacy for the patient using the curtain. I've explained the procedure, I've introduced myself, and I'm going to position the patient now so that they're at elbow height. And I'm going to identify the patient using two sources of identification. So I'd have the patient say their full name and date of birth, and I would confirm that using their identification tag. So Sam Samuel, date of birth 10/16/04. So the next thing I do is I would confirm the order, and I've already done that. And then I would also check on the specimen container, the patient's name and identification number, the route that we're going to be using, which is the oral route, obviously, and then today's date, and then my name. I'm the person collecting the specimen. So right now I'm going to wash my hands and put on gloves and goggles. So I would instruct the patient that what we don't want is we don't want saliva in the specimen container. So what we do want is we want any sort of sputum that's in the lungs or in the larynx. So we'd have the patient do 2 or 3 deep breathing exercises and have them cough. Once the patient has a specimen for me, I'll open up the container, and I'm going to instruct the patient to try not to release the specimen on the edges or the sides of the container, but right into the container. So 2 or 3 deep breaths and then a cough, and then the specimen goes in, and then I would seal the container. The container then goes into a sealable biohazard bag, which would also be labeled with all the things I stated earlier: the date of birth, identification number, the date and the route it was taken, and then my identification as well. So that would go directly to the lab. At this point, I would have the patient, I would offer the patient oral hygiene. So, and I could delegate that to nursing assisted personnel. I would remove my gloves and goggles and perform hand hygiene.